Information spreading among public stating that Indonesia is now at its third wave stage of the COVID-19 case surge.
And to confirm that information, joining us on Asia Prime, Dr. Siti Nadia Tarmizi, spokesperson of Indonesia's Health Ministry. Ibu Siti.
Yeah, good afternoon.
Welcome to the show. I'm sorry, I used to call you Ibu Nadia, yeah? All right. Ibu, Health Minister Budi Gunadi Sadikin stated the current wave would peak at the end of February or at the beginning or early March. What is expected to happen? Can you elaborate more?
Yeah, as we are aware, the total number of COVID-19 cases in Indonesia is tend to fluctuate. Since we can see there is the beginning of the pandemic until just recently. For example, in the middle June of 2022 to the end of 2021, we can see there was slight increase the number of cases. And then at the end of 2022 to around January to February 2021, another increases of cases and then start to decrease until May to June 2021. And then from June 2021, there is a steep increasing due to the Delta variant, and it achieved the peak around July 2021. And again, start to decrease until late October 2021. And here we can see there is again increasing number of cases. But a lot of projections have been made with various institutions. For example, the projection made by Institute for Health Metrics and Evaluation in English, which mentioned that the average of the country, it will be reach a peak around 5 or 30 days after first identification. And then there is some estimation from IHME that they mentioned about like Indonesia will have like triple or fourth or fifth time of the number. But anyway, it seems there is none of this prediction really have a right number what will be happen to Indonesia. Of course, we see there is increasing of number of confirmed case starting 2,000 and then up to 4,000, 8,000, 10,000, and today it was report like 17,600,000 of new confirmation case, and we aware it might be potentially due to the Omicron variant. So in terms of increasing of this number, it looks like we will achieve the peak of the cases around the third until first week of March 2022.
Okay, we're always talking about the race between two Vs. One V is the vaccine, the second is the variant. Our data has out of 208 million population, right?
61%.
That are 208 million population who are eligible to get the vaccine. Up until now, it's still at 61% those who have had the first dose. So what is the problem here, and what is the government doing to try to speed up the vaccine?
Yeah, of course, there is a number of people not yet vaccinated, but you can see this like for the first dose is like only like 18%, and there is like 38% who not yet receive the complete dose. We are of course accelerate this process, because we know that the number that has been not yet reached, of course, due several conditions. For example, because mostly the targets of the vaccination is among the rural area who have a challenge on the geographical and transportation, and then especially in the community who live in the island. So due to this geographical challenging, and then not all the information can already receive well by this target. So of course there are a little bit time to educate and then to provide this vaccination. In fact, we know there is still a lot elderly who not get any vaccine. either first dose or the second dose due to they have a misperception about once you elderly and you have a comorbid, so you're not strong enough to receive the vaccine. This is a very wrong message that they have received, yeah, because we know that for COVID-19, especially elderly and then the one who have comorbid disease, it should be the first priority in providing the vaccine because the risk of death and the risk of severe is really high among this group.